thank you very much, everyone, for coming on really a short notice. For those that don't know me, I'm Al Noyola. I'm the city manager here in Boulder City. First, let me just start by saying that I want to reassure everyone in the room that here with the mayor, the city council, myself, and all city staff, we are working very diligently in trying to maintain highest level of readiness as we deal with the issue that obviously is really gripping the world. We feel that we're trying to really stay abreast of what is going on and do so responsively without adding to additional stressors that everybody is feeling. I think what we're going to be presenting to you today will hopefully allay some of the issues and concerns that may be out there in the community. So we do have a video that we want to show you that comes from the CDC. I do want to ask the mayor to come up and just say a few words, and then after that I'm going to ask our emergency manager for the city to come up and kind of really talk about what steps we've been taking and what things that perhaps each of you ought to be thinking about to assist us in making sure that we do everything possible to ensure that we're ready and that we minimize the impact of this particular public health issue in this community. So with that, Mayor.
Well, again, I'd like to thank everyone as well for coming today. I know that there's an awful lot of information out there. We all are in contact with the Southern Nevada Health District. They are sending out updates constantly on the status of things here in Clark County. The figures that I saw yesterday, I believe there were 173 tests that have been performed in Clark County. Of those 173, 168 were negative for the COVID-19 virus. So there are 5 cases. 4 of those are what they call, James, help me out here, something like presumptive. Yeah. So they've tested positive with the test that the health district has given. Those results then go to the CDC for confirmation. There's one of the largest conventions occurring right now in Las Vegas. I was at meetings this morning at Clark County. There's certainly a lot of concern about this, but I think we're still in the stage where we're preparing, but we're not panicking about what's happening. So I think that's really the message that I'm hearing from all the other officials in Clark County. There is concern. It's being watched carefully. We don't seem to have any clusters of illness like we see in like Washington State or New York State. That just hasn't happened here. It may, and if it does, I think we're ready to do whatever is necessary. I know I spoke with Victoria, the director of the senior center, yesterday. They have plans over there as far as how to get food to seniors if they had to close the senior center. I see Mrs. Wagner here from Boulder City High School. All of us are getting information that I think is accurate and ready for us to act on if that becomes necessary. So I'll turn it back over to Mr. Noyola, and again, I appreciate everyone coming. A lot of important information, so thank you again.
Okay, before I bring up our emergency manager, I just want to introduce a couple of folks that I think you're going to get to know here really well in the coming days and weeks if you don't already know them. So one of the biggest, most important critical functions that happen in any of these types of situations to have a very good communication systems in place so we can get the word out and there's a way to get the word back into the city. So for the city, our PIO is Miss Lisa Foster. She's in the back, and she is going to be the single point of contact for communications in and out as it relates to this particular function. So if there's ever any question, that's your point person to ask questions. Lisa LaPlante. I said Lisa Foster, didn't I? Geez, I'm so sorry. Thank you so much. Lisa LaPlante, well, there we go. Miscommunication right off the bat, right? Okay, so she is our point of contact in or out as it relates to anything on this situation here. In addition to that, I am now going to introduce our fire chief, who's going to talk to you a little bit about the video that we want to show, which is about a 4 or 5 minute video. And then from there, talk about the series of steps that we've already taken and what we're planning to do as we go forward. Each and every one of you that are here, you're here, you were invited specifically because of the roles that you have either within your organization that resides here in Boulder City, or you're here representing part of the Economic Advisory Council, which you kind of been selected, if you will, as the spokesperson, if you will, to go out into those sectors. So for example, we have the high school principal, so anything that she gathers here, she will take out to the public schools here within Boulder City. Anything that happens in the public schools, she will be the conduit that brings it back. We have the CEO of the hospital, Mr. Tom Mayer, same thing. He's going to represent the medical community. Anything that happens in the medical community, he takes out or brings back into this area. If we should ever have to go to the step of actually formally staffing the Emergency Operations Center, we will actually have representatives from the hospital that will be staffed into the Emergency Operations Center so that we have that direct conduit and professional expertise in assisting us with anything that might be happening locally. So with that, Chief, if you'll take that on.
I'm Will Gray, the fire chief. Really, the meeting today came from we were having a lot of planning meetings, and the discussion was how can we get the word out to the community the best. Right now, there's really no reason to panic. I mean, that's the big thing is everybody, but there's a lot of planning and a lot of spooling up that's going on in the county. Like the mayor said, and the city manager, Clark County has stood up their MAC, or their multi-agency coordination center. There's a lot of just planning. It's one of those things where if we don't get ahead of it in planning, we're going to probably over-plan and hopefully nothing big happens versus wait around and something happen and we're not planning. So that's really what we're doing now. And in our discussions, we talked about who do we need to get that information out. And so we thought the leaders in the community that have a big sphere of influence would be the best way to do that. Instead of having a bunch of community meetings, we could share the information with you all, and then you can take it back to your people. So we thought we'd start off with a video. It's just a 5-minute video. I think that, to me, it explained coronavirus a little bit better and helped remove some of that bad information that we're getting out on the media. So
we need to get the facts straight. How does this virus work? How does it transmit? Where does it want to go? And let's protect ourselves. I'm Dr. Peter Lynn. I'm a family physician in Toronto, Canada. The coronavirus is a family of viruses that can cause as mild things as just a common cold, all the way up to SARS or MERS. These are these bad pneumonias that we're talking about. And basically what these viruses are, they look like a tennis ball with all these spikes sticking out of it. And depending on the type of spike, it allows that virus to attach to certain places. So some viruses, they have the spike that attaches to your nose. So basically you just get a common cold. But the SARS virus and this new virus that we're talking about has the spike that allows it to attach to the cells in your lung. And when it attaches there, it puts in information to make photocopies of itself. So it uses our equipment to make more viruses.
I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
Most of the coronaviruses live in animals. In this particular case, it was from Wuhan. There was a fish market where they were selling live animals. And the thought is that the virus was in a live animal, then it crossed into a human. But then what we found was that people were getting sick in terms of healthcare workers, in terms of family members that were looking after them, which now meant that the virus can pass from human to another human. Just like all viruses, it needs to reach a target, which is your lung. And it has to get there with your help. It has no feet and no wings. So therefore it needs us to move it there. So that's why we keep saying, don't hang around sneezy people because you're going to breathe it in. And don't touch your face because that's how the virus is going to get in. The masks are helpful, but they're not necessary because they're leaky. The ones that you and I buy basically have pockets here, so therefore the virus can get in. What the masks really do is they stop us from touching our face. If you're sick, we tend to mask you, so therefore you're not spewing out the viruses to other people sitting around you. The true people that have the real masks are the N95. Those are sealed. These are for the doctors that may be caring for their patients. So in the beginning, the coronavirus will cause kind of like flu-like symptoms or a cold. So people just get the stuffy nose, that kind of thing. But you'll understand that as soon as that virus starts manufacturing in your lung cells. They're producing all these copies of the virus. All of a sudden now you kill the lung cells. So now you can't exchange oxygen. And that's why one of the early symptoms is people get very short of breath and they tend to have a difficult time breathing, and that's why they end up in hospital. So currently, unfortunately, we don't have a direct treatment for the coronavirus. So we don't have a medication that can kill it off. And so it's really supportive. So in other words, the patient can't breathe. We give them oxygen, help them to breathe. They can't drink, so therefore we give them fluids to support them. Their kidneys begin to shut down. We help them with all those things. So it's a very supportive process. This is a new virus that we've never seen before. So our immune system, our army, are having a hard time figuring out what to do. So usually what we have to do is we make something called antibodies. So these are things that can grab onto the spike we see on the virus, and it'll get rid of the virus for you, and that will actually bring you back to good health. So therefore the elderly may have a worse outcome, and of course the young children. So the babies, their immune system is not so good either, so they may not make those antibodies as well. So just remember, your hands may be with virus. Virus cannot hurt you because it can't get through the skin. But the moment I do this, now I've brought the virus right to where it wants to go. So let's remember not to touch our hands to our face. So let's say you think that you might have been on a plane or you might have bumped into somebody that has it. What should you do? So the first thing is to contact a healthcare worker to tell them that potentially you have it. If you're feeling symptoms and you're going to go into a facility, call ahead. Okay, so whether you're calling the paramedics or whether you're calling the hospital or your doctor, just mention that you were on a flight. If you don't have any symptoms, then what we do is a little bit of a self-quarantine. In other words, we can just keep you away from other people, and so you don't go into parties, don't go with your friends, don't go into public transportation. So we can contain it very easily by making sure that you do a self-confinement, so to speak, for the, let's say, 7 to 14 days is the longest incubation time. So after that, if you're feeling well, then you don't have anything to worry about. If we get the facts right, then we don't have to be overly worried, but we do the right things so that we don't get the virus ourselves and that we don't pass it on to others. And if we look after each other in this way, this virus will have nowhere to go. It needs us to move it. It needs us to make copies for it. And if we don't help it, then the virus will stop. So we have the power to do that right now.
Really, our big goal today is our messaging. And over and over, the CDC says, wash your hands. If you're coughing or sneezing, stay away from other people. That 6-foot rule, that's where they talk about social distancing. If somebody's cold, they shouldn't be up in your face. If they are, step away. Hand sanitizer, the epidemiologist from CDC said, dial hand soap. It's plenty to kill it. It's a really weak virus until it gets inside of us. So one of the things we're recommending is we're going to do everything through the CDC as far as messaging. There's a ton of different flyers that the CDC has. Steve Walton, we can put some in the back for you to look at. You just go to CDC's website and look for the printed. There's tons of them about washing your hands and throwing away your tissues and basic stuff like that. We're encouraging people, if we could put those up in our public spaces, the ones that you're at, and just to remind people. I think that'll make a big difference. Same thing if we have public events, because the city has a lot of events in the parks and different things. Just remind people, in your groups, if people are feeling sick or something, maybe not go. And the same thing, maybe clean the bathrooms a little more frequently, make sure people are washing their hands. That's how we're going to stop this. I mean, it really is. The other thing to remember is, out of 300 plus million people in our country, I think 20 people have died. It's a really, from the flu, we've had 20,000 people die. So in perspective, this is a pretty minor thing. If we just wash our hands and be smart, it'll run its course and go away. One of the other things we're asking is, everybody in the room, we're going to put a sign-up sheet in the back. If you would just sign your name, the business group you're with, your phone number and contact email, we want to be able to send out like a weekly update to the people in the room. And that way, we can keep you guys advised so the public is reassured. But like I said, everything's in place. I mean, the county's running, the different fire departments are running, we have our different groups working. I mean, everything's moving like it's supposed to be. The big thing for us is just to get ahead of that disinformation, which there's a lot of garbage on the internet. And unfortunately, if people don't have information, they go look for it. And so we're trying to get the good information out there. I did have a couple questions for the group. Is there a risk or something in your specific focus that we might be overlooking? It goes back to we don't know what we don't know. So if you have a certain at-risk group or something that you're doing that we might need to be made aware of, it'd be helpful to share that. That way we can plan a little better for it.
doing the community Easter egg. I'm with Homestead. And so, the Easter egg hunt happens every year. This is the 66th annual Easter egg hunt on April 4th. Kind of wondering about that and your thoughts, and we have some ideas, so we're kind of wondering your thoughts.
I don't know that we would have any particular. Again, it just goes back to washing their hands, and I mean, do you guys have any suggestions for that?
Well, we are trying to not employ any draconian processes at our place, but we have put up notices about restricting visitation to the hospital. Again, what we talked about earlier this morning was just to underscore the fundamentals about social distancing, minimizing social contact as much as possible. I think you guys have to just make a decision for yourself, and then how you coordinate it. Just remind people that, if you're going to come to this event, if you don't feel well, don't come. Minimize the bringing children over there as much as possible. I know, yeah. Okay, I thought it was for the residents.
It's a big thing, like 800 kids. So.
Right. So let me just take kind of your question and maybe kind of just open it up a little bit more. And as we all know that, across the nation, even here in Las Vegas, events are starting to become canceled. That is not being canceled because of any emergency declaration or any of that sort of thing. It's really those groups are taking those steps, proactively in order to help to minimize, I suppose, the transmission of that. We actually have been discussing about, if or when we potentially might do that. And currently right now, we do know, like this weekend, I think we have a particular festival going on. Should that be canceled or not? Until we have an emergency declaration, we as the city would not be officially requiring the cancellation, but those that are sponsoring those events, just need to be cognitive that, the larger the gathering, the more likelihood of potential transmission. Is it something that perhaps maybe might be more prudent to postpone versus having it now? And that's really something that, those of you in the community, if you're sponsoring those kinds of activities, that you need to take that into consideration. Should activities or should, this manifest itself within the community, if the council feels that we need to take that sort of declaration, that might then drive some, official responses, if it needs to get there. But today, we're not there. But all the things that we've talked about with, the short video in terms of, what can we do to, really minimize the transmission, we should be doing, each and every day, regardless of whether it's a 2,000, person event or if it's just in your workplace. If we do that, we're going to significantly reduce the potential of transmission. But those of you that do have these kinds of events going on, or know of these events, or are members of the groups that are sponsoring these events, that's really a decision they need to make as to whether it's prudent to continue now. Can you put those things in place, or should it be something that maybe you postpone until, a little bit of time has passed, and perhaps, in the future might be a better time to hold that particular event?
So I'd reiterate again, the CDC has a really good website. So there's a lot of information on there for functions and sanitizing things and how to, like I said, the flyers, there's a ton of them. And so one thing I would ask is once we get everybody's email address, we'll send out a group email. And so if you have questions or concerns that you're not, that you come up later, if you'd send that through, we'll be able to work with that. And like I said, maybe integrate that into our weekly email that we're sending back out. We'll probably just do it through email in the future unless we need something else. Obviously, if we're going to encourage social distancing, having meetings where we're all together, it's probably not ideal. But so, any other questions? Do you have something else? Yours, boss.
Okay, so a couple of things I just want to highlight that as we move forward. So, we asked this group to come forward because a lot of you represent either those in a particular sector, for example, the healthcare. They will be communicating, this information through the healthcare, and hopefully they will be the conduit that will bring information back. So I encourage you to continue doing that. We at the city, we're not standing up any formal emergency operations or any of that sort of thing. The council will decide if and when that is to happen. But in the meantime, we are going to be standing up at least a weekly information. And as the fire chief said, after today, we're not going to bring a bunch of people together, but we're really going to do it more by teleconference, probably, that, maybe we have a standing meeting. It's much like what the regional folks are doing. We're all doing it by teleconference instead of all of us gathering one big, huge room. So we're trying to set up something that perhaps we can do at a certain date and time. This is where, we're going to do the teleconference. This is the update, and then at least we can share, here's what's going on this week, here's what we're preparing for, and we can kind of continue that, dialogue back and forth. So what your city government and all of the other entities are doing as far as within Boulder City, but also we can communicate with you about what's happening in the region and how that may or may not impact, the particular sectors that you're with. In addition to that, we did talk about, obviously there are populations, that are higher at risk. And so, we are going to be doing some additional outreach to those that work with those particular sectors, that population, to start looking at what more do we need to do to make sure that we're addressing any concerns about how do we support that population should, they become infected with the virus and it affects their ability to, do their day-to-day living. So what I wanted to end with is, again, let's make sure that with the message we're sending out, from you, from the city is, continue to live your lives, but be cognitive about, what we should be doing. As you walk out, there is a little dispenser out there, wipe your hands, that sort of thing. All of these simple things really are huge efforts in minimizing that transmission. An ounce of prevention is worth a pound of cure. All right, and that's really what we're talking about, is whether it's, what we do about washing our hands, preparing just in case, and hopefully it never happens. And so each one of us have, I think, a vested interest, whether, wherever it is that, you're representing, to assist in doing that. So having said that, the other thing also I failed to mention is that our website will have links to the latest information. We're developing a fact sheet that we want to make sure that is out there and updated. So as new information comes in, questions and whatnot, we will continue to add those out there so that will be kind of a central point. If you have web pages and you want to link it to ours, please do so. What we want to make sure is that all of us are sending out the same information, or at least pointing to the same spot. So the information is all the same regardless of where you're going to, and the residents or your particular customers or who you're representing. So everybody's getting the same information. Any questions on that? Again, thank you so much for your time. I just want to make sure that we did this initial effort. You will, make sure you leave your information up there on that sheet. And then what we will do is make sure that we contact you and we let you know, when the next meeting is via teleconference. And we're not going to be getting back together again. Love you all, but no. Okay. Thank you so much.